So today's patient is not yesterday's patient, and their healthcare needs are just dramatically different. So when I was training, people received hard copy handouts on their health condition, but the young adults I care for are not looking for that. They're looking for online information, often in video form, that speaks to them. There's a degree of anti-authoritarianism, so they don't necessarily always want information that's delivered by a talking head specialist. They want information that includes the patient or the community voice, information from their peers. I think that we need to rise to the challenge and meet our patients where they are. And one of the goals of the program is to serve as a national resource for young adults that are looking for information on congenital heart disease and heart failure, and which is reliable, relatable, authentic, which centres community voice and which responds to their needs and priorities. I think that there's a lack of information because there's a lack of awareness that heart failure is a common problem for young adults with congenital heart disease. I think that it hasn't been organised. I think the conversations are happening in online forums. My patients tell me they're getting information through sites such as Facebook and Instagram and TikTok, even Pinterest. I think our job is to learn more about that and find out what's working on those spaces and how can we play a role in speaking in a way that is meaningful and of value to our patients and families. Congenital heart disease is actually being called the original heart failure syndrome. So there are some that believe that all people with congenital heart disease have a form of heart failure. And in fact, if you look at the American College of Cardiology guidelines and classification systems, they would define all congenital heart disease patients as heart failure patients too, a stage B heart failure. But that approach hasn't been helpful in any way. And to say that all congenital heart disease patients are heart failure patients is not helpful because it doesn't direct those individuals to care that's tailored to their needs. That is part of the work that needs to be done. It's building awareness and even agreeing on a consensus definition for heart failure in adult congenital heart disease. And the Mayo Clinic Adult Congenital Heart Disease team has really been playing a leading role in the research that's helping to define heart failure and what it is for those young adults we're seeing with congenital heart disease.